Do you struggle with lower back tension when you're running? I'm gonna show you exactly how we fix it. And no, it's not gonna be more core training or core work. That's actually counterintuitive. One of the things that we're probably missing is getting your hip to actually extend. And I'm gonna show you exactly how to assess whether or not you have proper hip extension. And if you don't, how we're gonna be able to solve that for you. We've gotta look at how well your hip extends. And this is my favorite screen, the chest out hip extension. So we're just gonna get into the couch stretch here. And you're gonna keep a knee under your a pad under your knee. And I want you to be a straight line from your shoulders, hips to your knees. And if you're in this position, it should feel fairly comfortable. You get a little bit of a stretch, but there's gonna be a lot of people that are like this, right? It's gonna be really, really hard for them to extend their hip. So you gotta be stacked over the back leg, heel to butt, and be able to hold this without a problem. If this is something that's very, very limited, it's gonna be something that we're gonna assess. You can still utilize this to improve mobility, right? Hold the position, but it's a more efficient way to actually get the outcome of improving your hip extension. First thing that we're gonna do to start to improve your hip extension is just see how well your pelvis actually moves into an anterior and a posterior tilt. So anterior tilt is when we move, if we think about our pelvis like a bowl of water, it dumps the water forward. And a posterior tilt is when we pull the belly button towards our chin. But what you're gonna find is when people anterior tilt and posterior tilt, they exaggerate the motions, they bend their knees, or they'll lose height. Our goal is just to have this small, gentle, and controlled motion. If it's hard to do it upright, it's fine. You're gonna start on the ground. So when we start on the ground here, just get nice and comfortable. I want you to really focus on exaggerating the extension and the anterior tilt of the pelvis, and then reversing it where you're almost crushing your lower back into the ground. You're flattening the lower back into the ground. And as that starts to feel more comfortable, what we can do is start to synchronize our breath with the tilts. So it's gonna be a gentle anterior tilt in the big inhale. Feel the air in your belly and your chest. And then you're gonna exhale. And the exhale is gonna depress the ribs and retract it, which is gonna allow you to really posterior tilt more efficiently. And you're just gonna go back and forth. Inhale. Exhale all the way. If this is really, really hard to control, it's a very easy starting point to start to improve your hip mobility, because where your hip flexor is attached actually to the front of the pelvis, and the pelvis stays in the same position, it's not gonna be able to mobilize efficiently. So this is where we start. Then we'll start to layer in more active mobility drills. As you start to work on the pelvis, one of the things that we can do is start getting you more upright. This stagger stance, reach with rotation, is a great way to start to stretch the hip flexors. The hip flexors are gonna come up from here and connect to your actual spine. So you wanna move the legs into extension, and you're just gonna shift your weight forward with your arm overhead. That feels okay. You're just gonna chop this arm, cross body, and rotate away. And you're just gonna move forward and back from there. And what you're gonna feel is a stretch in your hip flexors, your obliques, and this opening up as well. You're just moving forward and back. And you can compare it side to side and see how it feels. Like in this way, I don't feel much of a stretch in the hip flexor. When I have my right leg back and I move this way, I feel a nice opening here. And typically we can go for 10 to 15 repetitions. The way to progress it is just try to reach the arms further and further each subsequent rep. The next exercise we're gonna do is to the half kneeling halo. The half kneeling halo typically is thought of as something that's gonna be for upper back mobility and shoulder mobility. But what we're actually challenging is that we're rotating the kettlebell around our head. It's forcing our hips to stabilize in this half kneeling position. So you're gonna feel a nice stretch in the hip flexor. So we just start here. We'll go 3 in each direction. And I want you to pause at those points. And you should start to feel this hip stabilize this half kneeling position. As that gets easier, all we're gonna do is go a little bit more in line. When we narrow that base of support, that back hip's gotta work a lot harder to stabilize you there. So in this, you start to have that narrow base, and you're just actively thinking about that knee driving into the pad. If that gets easy, you can elevate the front leg. And this, again, starts to reduce that base of support even further. And your goal is to just maintain that knee down pressure into the pad, which is gonna open up the rectus and the hip flexor to improve that couch stretch position that we're talking about. So with the half kneeling position in the halo, it's definitely gonna be challenging the hip flexor, but we're gonna keep constantly putting more and more load into the tissue so that we can create adaptations over time. This exercise is fairly simple, doesn't require any equipment. We're just gonna get into a long kind of lunge position, and we're just gonna drop straight down. And I want equal angles, so 90 degrees in the front leg, 90 degrees in the back leg. Most common mistakes you're gonna see here is someone's shifted very forward, and they're gonna place more stress in the quad. And there's gonna be a lot of people that don't actually dip their knees that far down into the ground, but you're gonna feel a ton of stretch in your quads. And from the front, I don't actually want the knees to go inward. I want the knee to be in line with your hip. So you feel a stretch that kind of opens up like externally. It almost feels like your thigh is rotating outward. This next exercise is just gonna be called the reverse Nordic. And you're getting into this tall kneeling position, making sure that you're keeping your pelvis in a more neutral position. You don't wanna be too extended and lead with extension from the lower back. We wanna keep that pelvis tucked. And as you keep it tucked, you're just gonna slowly lean back. And you should feel a stretch throughout the whole quad and hip flexor. If you don't feel it in the hip flexor, I just want you to create a little bit more of that emphasis of that tilt, and then stay nice and tall and lean back, and you should feel that stretch start to creep up a little bit more. You're not gonna be able to get that far initially, and that's okay. Just work on the ranges that you can control, and over time, progress further and further and further and further and further back. But if you start just here, as long as you can feel a stretch in your quads and your hip flexors, you know that you're doing something productive. And I'll go for 10 to 15 repetitions on this one. So after you do all these exercises, you're not gonna be able to do some of the harder ones like the reverse Nordic right away. You might be sticking with just the reaches and then starting to implement maybe some split squat isos. Whatever you can tolerate, start there. And then when you do those exercises, retest the couch stretch position, the original mobility screen, and see how that feels. If you're seeing improvements in the couch stretch, do those exercises first before actually doing the couch stretch itself as a stretch. If you're doing a stretch, try to make sure that you're holding that stretch for at least 45 to 60 seconds. Hopefully that was super helpful. If you're someone that's been dealing with tight lower back tightness and lower back pain when you're running, hip extension is definitely one of the biggest culprits. If you're dealing with something that's way more complex, meaning you've got maybe lower back tension, some hip pain, some knee stuff, we work with so many runners here in New York City, and we consult with people virtually throughout the world. So if you want to book an evaluation with our team, just check the show notes, and there's a link that'll have momentptp.com, contact us, and then we'll take care of you from there.